Hey there, folks. Today, we're diving into a topic that's incredibly important when it comes to understanding what's really going on inside our bodies: inflammation. Now, you might be wondering, how do we actually measure inflammation? It's not something we can see with the naked eye. That's where blood tests come in. These tests look for specific markers that give us clues about whether inflammation is present, how severe it might be, and sometimes even what's causing it. So in this video, we're going to break down the most commonly used blood tests for inflammation, what they mean, and when they matter. Let's get into it. One of the first tests you'll often hear about is C-reactive protein, or CRP. CRP is a protein made by your liver in response to inflammation. It doesn't tell us exactly where the inflammation is or what's causing it, but it does tell us that something's going on. Elevated CRP can point to infections, autoimmune diseases, or even tissue injury. Now, there's a more sensitive version of this test called high-sensitivity CRP, or hs-CRP, which is especially useful in detecting low-grade chronic inflammation, the kind we worry about in heart disease. If your hs-CRP is elevated, it could be a red flag for cardiovascular risk, even if you feel perfectly healthy. Next up, we've got the erythrocyte sedimentation rate, or ESR, sometimes just called the SED rate. This test measures how quickly red blood cells settle to the bottom of a test tube. When inflammation is present, proteins in the blood cause cells to clump together and fall faster. A high ESR can indicate things like autoimmune diseases, infections, or chronic inflammation. It's especially useful in conditions like rheumatoid arthritis and lupus. Then there's the complete blood count, or CBC. This is one of the most routine blood tests, and while it doesn't measure inflammation directly, it gives us clues. If your white blood cell count is elevated, it could be a sign of infection or systemic inflammation. Sometimes the pattern of white cells, like high neutrophils versus high lymphocytes, gives us a hint about whether it's bacterial or viral. Now let's talk about fibrinogen. Fibrinogen is a blood-clotting protein that also increases in response to inflammation. Elevated fibrinogen is seen in infections, injuries, and chronic inflammatory states. It can also raise your risk of forming clots, which is why it's relevant in cardiovascular disease. Another important marker is serum amyloid A, or SAA. This is an acute phase protein like CRP, and it rises rapidly when inflammation occurs. It's particularly sensitive and sometimes used in conditions like rheumatoid arthritis, inflammatory bowel disease, and autoimmune flares. Speaking of infections, there's one marker that helps us narrow things down: Procalcitonin. This test is especially helpful for distinguishing bacterial infections from viral ones. High procalcitonin levels are often seen in sepsis or bacterial pneumonia, and doctors may use it to decide if antibiotics are needed or not. If we're talking about autoimmune diseases, there are a couple of key tests that come into play. One is rheumatoid factor, or RF, an antibody that's often elevated in rheumatoid arthritis. Another is anti-cyclic citrullonated peptide, or anti-CCP, which is more specific for rheumatoid arthritis and can show up earlier in the disease. There's also the anti-nuclear antibody test, or ANA. This is used when we suspect conditions like lupus, scleroderma, or mixed connective tissue disease. A positive ANA means your immune system may be targeting your own cells, but it's not a diagnosis on its own, more like a clue. Now let's talk about cytokines, which are proteins that help regulate inflammation. Interleukin-6, or IL-6, is one of the more well-known ones. It plays a key role in the inflammatory response and tends to be elevated in chronic inflammatory diseases, infections, and even some cancers. During the COVID-19 pandemic, IL-6 became a big focus in severe cases. Another important cytokine is tumor necrosis factor alpha, or TNF-alpha. This one is involved in systemic inflammation and is commonly elevated in conditions like Crohn's disease, psoriasis, and rheumatoid arthritis. Medications like infliximab or adalimumab work by blocking TNF to control inflammation. Then there's D-dimer, a test that comes up a lot when we're concerned about blood clots. D-dimer is a breakdown product of fibrin, and it's often elevated in conditions like deep vein thrombosis, pulmonary embolism, and sometimes even severe infections or inflammatory responses. It doesn't confirm a clot by itself, but a high level tells us we need to investigate further. One more marker worth mentioning is haptoglobin. This is a protein that binds to free hemoglobin when red blood cells break down, but it can also increase during inflammation or tissue injury. It's less commonly tested, but can provide supportive information in certain scenarios. Now, here's the key takeaway. No single blood test tells the whole story. These markers are pieces of a puzzle. Elevated CRP or ESR tells us inflammation is present, but not why. A positive ANA might suggest autoimmunity, but we still need more data. That's why doctors often use a combination of tests, along with your symptoms, history, and a physical exam, to figure out what's really going on. So if you're feeling unwell or dealing with symptoms like fatigue, joint pain, unexplained fevers, or swelling, blood tests for inflammation can help point us in the right direction, but they're never the whole answer by themselves. And if you're ever unsure about your test results, don't be afraid to ask questions. The more you understand what these markers mean, the more informed you'll be about your own health, and that's powerful. Thanks for tuning in, and I'll see you in the next one.